So, thank you so very much for having me over here, and it's a wonderful organized meeting. So, we are going to talk about monochrome cataract surgery. Is it here to stay? So, when you photograph people in color, you photograph their clothes, and when you photograph them in black and white, you actually photograph their souls. I'm a great fan of black and white photography, so that's something that I would actually like you all to see now. So this is basically on Ingenuity, which is a 3D heads-up surgery. And we incidentally found out this filter called the monochrome filter. We were just trying some different things. And we realized that because of the change of the entire high dynamic resolution into a single tonal value, you get an enhanced glow and an enhanced contrast in certain steps of cataract surgery. Like this is especially done in rhexis. You can see the hydrodissection wave much more enhanced than what you would see in color. So we tried doing the phacoemulsification also in the same filter, and I didn't find a big difference, but my colleagues did not like it during the phacoemulsification, and that goes with the studies which have said that, yeah, probably the depth perception is not that great in phacoemulsification. So if you're looking at polishing the capsule, we're looking at doing the irrigation aspiration. The minutest details and the specs are seen more enhanced in this particular filter. So it helps you in cleaning the capsule much better. So this is the alignment of the toric IOL which we have done. This is just another case in which I am showing how the specs can be seen and cleaned with more efficiently with using the black and white filter. I'm going to skip a few things and show you the difference between the sudden contrast change that we get. Now here, when I change into this particular filter, you can see up here, there is a very small peripheral rent out there. And you can actually see the fibers of the vitreous in the same, because of the high dynamic resolution. So the contrast values help you discern between even the viscoelastic that you would use and the vitreous. So here, in such a difficult situation, because of the visualization, I am able to do a PCCC in that area also. So here I am going to do a PCCC out there in that area, and then do a vitrectomy. And now you can see the difference between the viscoelastic and the vitreous. So the viscoelastic will be stable with waves, and the vitreous will be the one which will have fibers, and they will have both different tonal values, and you can actually see the difference in the tonal values out there. So the indications where I use monochrome is basically cortical cataract, CCC, hydrodissection, cortical wash, especially in femtocataract, wherein it's very difficult to discern the cut edge of the cortex, posterior capsular polishing, difficult cases like anterior optic capture, and many other things in which you want that contrast to be much better, CTR insertion, PCCC, anterior vitrectomy, and cataract with corneal opacities. In fact, you can do enhanced moonlight phaco with these kind of cases. So what do you do when the glow fails and you don't have the dye, or you hate the dye? So this is a case in which it's a cortical cataract, and I realize that I'm not able to see it there, and the moment you change it into a black and white filter, you will suddenly see that enhanced thing, and you'll be able to see the entire rhexis margin very easily without using a dye. Thank you for watching the soul of the cataract surgery. Thank you.
Excellent presentation. I just wanted to ask whether this filter comes as an buy it separately as an attachment?
No, this is on the Ingenuity, so
Yes.
that's the software. So it's
We have recently acquired Ingenuity, but I
Yes.
have not. I've done only 3 or 4 cases on that, but I didn't know that this also exists.
so this is a wonderful thing for these particular indications. So it works pretty well.
So it's an inbuilt filter.
Yeah, it's an inbuilt filter.
Other thing is when you have a PCR with witness loss, so you don't need to use triamcinolone now if you're going to use this filter.
Yes, but you can use triamcinolone. It enhances that as well, the stain and everything. The only issue with the filter is the blood vessels are not seen. So it blanches out the entire limbus. So for the main incisions, you still need to go into color.